Welcome to the American Health Revolution podcast. Did you know that America is literally the sickest nation in the industrialized world, even though we have the best resources available for curing disease? At the center of our chronic disease epidemic is Autism Spectrum Disorder, which now affects 1 in 31 American children, an alarming increase over the last 2 generations when the number was more like 1 in 5,000. Now, this surge is not due to better diagnostics, as many of those with sort of a profit over patient mindset would have you believe. No, a significant percentage, as many as 30% of autism cases are profound, where families suffer deep, long-lasting effects with very little or no relief. Think about that. 1 in 100 American children today with profound autism. And think about their families. Our guest today is the highly accredited Dr. Sylvia Fogel, who is the co-founder of the Autism Innovation Coalition. Dr. Fogel is the parent of a child with profound autism. She understands firsthand the complex life-altering challenges that families with autism face on a day-to-day basis. Since 2019, Dr. Fogel has been a tireless advocate for access to special education services at the legislative level in her home state of Massachusetts. In this discussion, she will explain the absolutely urgent need for systems biology and functional medicine as approaches in treating autism and other NDDs. We'll also discuss attempts to get to the bottom of the root causes of autism. And what can we do in our own communities? Well, perhaps that begins with awareness and an understanding of what we discuss here today. So thank you so much for joining us, and stay tuned.
When my son was a little over 2 years old, after having developed fairly typically, in fact, doing developmentally very well, he had an acute developmental regression, what we call a neurodevelopmental regression, or NDR, shortly after his 2nd birthday in the context of a prolonged upper respiratory infection. And within a couple of weeks, we really lost him. He lost all speech. He lost all eye contact. He lost all ability to engage. His temperament changed. He spent a lot of time crying and distress. He developed odd motor movements in his upper extremities. And despite being affiliated with Columbia at the time, where I was teaching residents and medical students, despite having this affiliation with, this incredible academic medical center, really, there was no one who could tell me what had happened to my son or what to do about it.
Hello, everyone. Welcome to American Health Revolution. This is Paul Labosco with my tireless colleague and health advocate, Karen McDonough. How are you today, Karen?
Doing great, Paul. Good to see you.
Yes, we're both excited. We have Dr. Sylvia Fogel with us. Dr. Fogel, thank you so much for taking the time to be with us today.
Thank you for having me, Karen and Paul. It's great to be here.
It is, and we have a lot to get to today. We're going to be talking about autism. We're going to be talking about the Ford study that you were part of evaluating, and you were part of a documentary there. We're going to talk about some things regarding the medical profession and your journey and how you've gone from your days in med school and how your career path has evolved. And I'd love for you to just spend a moment or two, because I think it's really important as a backdrop to what we're going to be talking about. Very important topics we're going to be talking about today. And your history, your personal journey, your professional journey have all shaped the voice that you have today, which is a very important voice in medicine. So would you just spend a couple of moments talking about that for us?
I went to medical school at Cornell University. I did my residency training in psychiatry at Columbia University. So I was very much trained in traditional allopathic medicine. I was always interested in complementary and alternative modes of healing, particularly Eastern traditions, but also nutrition, although did not receive much training about those topics, in my traditional medical training or residency. My shift into health advocacy and autism advocacy, I think, is similar to that for many autism advocates, where I had a family situation of my own, which really propelled me toward different ways of thinking about health and healing. When my son was a little over 2 years old, after having developed fairly typically, in fact, doing developmentally very well, he had an acute developmental regression, what we call a neurodevelopmental regression, or NDR, shortly after his second birthday in the context of a prolonged upper respiratory infection. And within a couple of weeks, we really lost him. He lost all speech. He lost all eye contact. He lost all ability to engage. His temperament changed. He spent a lot of time crying and distress. He developed odd motor movements in his upper extremities. And despite being affiliated with Columbia at the time, where I was teaching residents and medical students, despite having this affiliation with, this incredible academic medical center, really, there was no one who could tell me what had happened to my son or what to do about it. And like many parents who experience neurodevelopmental regression, I was sort of left on my own. Not only that, but prior to having a neurodevelopmental regression, my son developed at around the age of 1 very serious gastrointestinal issues. And again, I discovered that my academic colleagues in the gastrointestinal department at Columbia didn't have much to say or do to help me or to help him. And when I think about it, I'll probably jumping ahead now, but when I think about a systems biology approach to autism, I do think that what was happening for him at the level of his gastrointestinal tract really did ultimately influence his immune system and ultimately his developmental regression. So my son is now 17. He has a minimally verbal, profound autism. He requires 24/7 care. And so I've been, for the past 15 years on a journey to really understand autism, our predisposing factors, health and healing in general, and have really gravitated more toward functional medicine and integrative medicine.
With a real sense of purpose. God bless you. God bless your son. I would love to meet him. I really, truly would.
He's an amazing soul. He really is. And in the context of what I've learned in trying to help him, I actually now have a practice that is, guided by integrative and functional medicine principles, where I treat general psychiatric symptoms, but also autism and PANS and PANDAS, so neuroimmune disorders.
Right.
Karen.
And Sylvia, you're also involved with the families of children that are similarly affected, right?
Yeah. So I have done a lot of work with parents, particularly when I was working at an autism center at a major academic medical center in Boston. My primary role during the time that I was there was to work with parents, and parents of individuals affected with autism and other developmental disorders face enormous stress and health challenges of their own, including mental health challenges related to the complex and sort of endless caregiving demands of many of their children. And so it was really a pleasure for me to work with parents. I think one of the things that was really meaningful for me is that the families that I worked with really understood that I got it, that I understood what they were going through. In some ways their challenges were my challenges, and I was able to bring my personal experience directly, informed my work with the families.
And that's so important because, with this new administration we have, and with Secretary Kennedy taking over HHS, there's been a lot of pushback when he's talked about, how devastating autism can be on the family. It seems that there's, kind of not a really good understanding in the public about what severe autism looks like. Can you talk a little bit about that?
Yeah, I'd love to talk about that because I think it's really important. I think over the past 10 years or so, we've kind of lumped autism together into this spectrum model. I actually think that the kind of autism that prevents primarily as neurodiversity, where people are high functioning, where they can be academically successful, where they can communicate themselves, where they can advocate for themselves, is actually fundamentally different from people on the more severe or profound end of the spectrum, who often have severe co-occurring medical conditions, autoimmune disorders, gastrointestinal disorders, pain syndromes. These are individuals who often can't communicate verbally effectively. Either they're minimally verbal or sometimes nonverbal. They have severe motor coordination disorders called apraxia that make it difficult for them to do basic functional tasks like toothbrushing, like preparing a meal, like hygiene practices, like getting dressed. And so these are individuals that require 24/7 care for the rest of their lives. And many of them can often also suffer from significant neuropsychiatric symptoms, including obsessive compulsive symptoms, severe anxiety, tic disorders, episodes of aggression, and severe self-injury. So not only are the basic caregiving demands very, very onerous for many families, but they are also witnessing abject suffering day in, day out that would bring most people to their knees. And so when Secretary Kennedy in the past has described individuals with profound autism and said, has outlined the ways that they can't participate in this society, he is 100% accurate for this profound and severe end of what we're calling a spectrum. But what I propose to you today and to your listeners are actually two very different things, with probably underlying different systems biology as well. These families suffer incredibly. And in fact, we have data that shows that very good data from multiple different researchers over the years, that parents of children with autism have markedly different stress hormone profiles. They have significantly higher rates of anxiety and depression and suicidal thinking. There's even one study that looks at a kind of it's called a progenitor cell. It's not quite a stem cell, but it's kind of like an early cell that can in the body that can help modulate and regulate capillary function and is associated with cardiovascular outcomes, that even showing that mothers, in this case, mothers of children with autism, had markedly lower levels of these progenitor cells, which put them at higher risk of cardiovascular disease and stroke going forward. So there are physiologic changes in our parents that reflect the magnitude of the chronic stress that they are contending with day in and day out.
This relates to the work you do every day.
Right. Yeah.
With these families, with the parents.
Yeah. One of the things that I've tried to focus on in the families that I work with is really supporting the parents um, and really teaching them to privilege their own needs and make their own needs part of the equation in the midst of the enormous caregiving demands for their children, and to really learn techniques to modulate their own nervous system, breath techniques, meditation techniques, different eye movements, making sure they're getting exercise, making sure they're getting sleep, which of course is much easier said than done when you're contending with the kind of behavioral issues, neuropsychiatric issues, and basic caregiving issues that many individuals on the profound and severe end of the spectrum require. So it's all easier said than done. But I think even parents being able to give themselves permission to privilege their own needs is a really radical shift for many parents, mothers in particular.
I can certainly relate to that.
Me too.
Yeah, and we know that autism has proliferated, kind of exploded in the last several decades, right? The last 2 generations or so. And I believe the number is now 1 in 31. Now that's across the spectrum diagnosis. There has been some better diagnostic techniques that increase the numbers, but we're seeing an increase in autism generally without regard to diagnosis. And I believe you can enlighten us on what percentage of those autism diagnoses are of the more severe variety that Bobby Kennedy was talking about. It's not a small number, is it?
Yeah. So roughly 25 to 30% of those diagnosed with autism have profound or severe autism, level 3 autism. So at least a quarter of those diagnosed are on the most severe end of the spectrum. I think with regard to the rise in rates, I think there has been some better diagnosis. I think there has been some expansion of the criteria used to diagnose autism. And so there has been an expansion of people sort of maybe with more mild symptoms of autism. However, I think the data is very clear from multiple sources that there has also been a rise in profound autism. And to me, in my mind, having looked at the data, there is absolutely no question that this is a real rise that tracks with the rise of many other health conditions, like the rise of type 1 diabetes, like the rise in asthma, like the increase in pediatric inflammatory bowel disorders, like skyrocketing rates of anxiety and depression. So it's not as if the rise in autism is occurring in isolation. We have a massive shift and increase in many chronic health conditions, many of which are mediated by the immune system, and which may have, underlying factors, risk factors. But there's no doubt in my mind that the rise in autism is real. And I think, if we just practically look at the number of autism coalitions, autism treatment centers, which are slammed, by the way, and often have long wait lists, even though the number of them have increased.
ABA for sure.
And if you ask, I think people who've, anyone who's worked in a school district over the past 20 years can tell you that the needs for special education services have increased dramatically, and it's not just better diagnosis.
Right.
So there's some external factor involved, where we don't know exactly what that is, but the studies haven't really been done, right, Karen? And what we're hoping this HHS does and CDC is actually get in the weeds and find out what the hell is causing this explosion in chronic diseases, not limited to autism, but certainly including autism.
Right.
Yeah.
I mean, I think it's likely that there's a confluence of multiple different exposures. And it really, it fits with a model that was developed by some colleagues that I work with as part of a group called the Autism Innovation Coalition. But we have a model where we think about environmental exposures and toxicant exposures as falling into kind of three broad categories. Primers, so exposures that kind of weaken the resilience of cells or mitochondria or the immune system, but still the person is like able to compensate. And then triggers that cause acute disease, acute neurodevelopmental regression, symptoms, pathology, where the system's no longer able to compensate. And then we think about amplifiers, so things that prevent the body from healing and resolving whatever or contending with whatever the underlying trigger is. That could be, again, a toxicant exposure. It could be an acute immune trigger, lots of different things. So I think that model is really this primers, triggers, and amplifiers model can really help us think more systematically and in a more nuanced way about the number of different kinds of exposures that we're having during the course of a lifetime, including in utero. And one of my colleagues is Dr. Judy Vanderwater, who's done a lot of work on maternal immune activation. She likes to now call it maternal immune dysregulation, which I think is probably a better term. But really, the ways the maternal immune environment is already potentially creating either resilience for the new baby or vulnerability for the new baby.
Right.
Mm-hmm. Yeah.
And what would that look like? What would some of those, susceptibility with immune function in the mother, what are just some examples of what that could be?
So maternal infection,
Mm-hmm.
a high degree of toxicant exposure, so mercury, potentially aluminum, poor nutrition, I think is huge. We know that enormous numbers of Americans are insufficient or deficient in one or more nutrients. And so that definitely can present itself during pregnancy as well. And then we know that there's data even, with respect to autism, that things like maternal preeclampsia, which is a kind of a total body, say, kind of vascular immunometabolic disorder in pregnancy increases the risk of autism. There's very good data that maternal obesity, probably via increasing maternal immune inflammation and immune dysregulation, is a risk factor for autism. There has been some data looking at air pollutants as a risk factor for the development of autism, so pollutant exposure during pregnancy. So I think despite the fact that over the past 15 years, that our federal agencies have directed a lot of the autism funding toward genetics, there has been some good research happening in terms of environmental exposures and the underlying systems biology, but we need much, much more work and a concerted, coordinated effort to understand the system's biological underpinnings, of these exposures and ways that we can promote resilience in mothers and offspring.
It reminds me of the need to devote more resources to prevention and cures rather than treatments, right? Which is where the bulk of money goes. I'd like to shift the conversation a little bit, Dr. Fogel. I have no doubt that if the majority of those in the medical profession were like you, truly putting the patient first and seeking wellness and applying more of a functional medicine approach to your practice, that people would be healthier. I truly, truly believe that. When we go back and we look at the history, and you mentioned allopathic medicine earlier, and we look at the way things have gone. Now, you may or may not agree with this, but from where I sit, there's been a sort of this creep effect of an unconscious motive to put profits over patients. And the doctors, there's a growing number of them, the doctors who have the courage to speak out and challenge some of the narratives that come from what I refer to as the medical industrial complex. These doctors have been tarnished, smeared, some have had their licenses revoked, all for trying to do the right thing and putting their patients first. Now, I've seen this. You've seen it too. It must be incredibly difficult for the doctors to operate in that type of environment where they're almost forced into this narrative from above. Any thoughts on that?
Yeah, I think it really is hard for doctors right now. I think particularly now when there's been so many mergers and these enormous medical systems that are largely run by administrators and the financial needs of the institution, I think doctors are really in a bind. Their quality metrics are judged by how many patients they see, how many relative value units they earn during the course of a day or a week or a month. So the quality metrics are perverted, I would say, right? We're not measuring quality by who doesn't come back and who doesn't need to come back. We're measuring quality by like the number of visits and I think many physicians are also frustrated that they don't have tools to help people with chronic illness. They enter this profession to alleviate suffering and to help people and with the most highest intent. And then often what happens is that the tools in our toolbox are sometimes helpful for alleviating acute suffering.
Right.
But not for actually bringing people back to a state of health, whether it's psychological health, physical health. And I think many physicians really feel frustrated by that. Even those who aren't interested, let's say, in functional or integrative medicine, or what some people call root cause medicine. So I think it's very difficult. The patient volumes, the fact that people aren't getting better. Now it's different for different specialties. I think, for example, surgical subspecialties, I don't think are feeling this the same way. Or people who work in, intensive care units or people who are involved in sort of treating, acute traumas. I mean, I think there, the medical system does a really, really good job. If you fall and break your hip, skiing, you can get an amazing surgical procedure and a brand new hip and, maybe even be back skiing the next, or running or whatever, So there are some places that medicine is excelling, but in terms of dealing with chronic illness, we're really not doing a good job. And I would say, including mental health, chronic mental health issues and psychiatric symptoms as well.
And chronic illness is much more complicated, right? There's so much variability and like even just in autism, for example, right? The symptoms, the level of functioning, the underlying comorbidities. Have you found that a lot of physicians who do go into sort of a more functional medicine type, or sort of dealing more with chronic illness, are affected by chronic illness?
Almost everyone I know in sort of the integrative or functional medicine community is there because either they or a family member had a health challenge that wasn't being adequately addressed within, standard of care, mainstream medicine. And that's the case for me. I honestly can't even think of, maybe there's some practitioners who really have just been interested in the beginning or have maybe a tie to sort of Eastern philosophies or native ways of healing, or, people come at this from different, but many, many people in this space are here because, either we ourselves or a family member has had a health challenge that wasn't getting better.
Yeah. This is not new. Our country has a history of this. Some people are familiar with this quote from Thomas Jefferson. And, we get back to the basic concepts of food and medicine, and that's what this country was founded on, the concept of being free from medical tyranny. And I refer to this medical industrial complex, but they also operate with the media industrial complex, Dr. Fogel. These companies are allowed to advertise on television. It allows for this landscape of propaganda that they can create among the masses that allows them to, continue to operate in this profit over patient model. Other countries don't allow this. So lo and behold, our patient outcomes in this country are the worst in the industrialized world. And I think it's largely a function of how the system operates and how addicted they are to power and profit. And when I say they, I mean everyone from big pharma companies to the WHO and some of the agencies here, and perhaps the politicians who are, not too uncomfortable accepting lobby money to have, bills passed that benefit these companies. So it's kind of developed into an unhealthy legislative political environment, and I think we need as a people to recognize this, because the exploitation of human health for profit is something we simply can't stand for. That's why I'm doing this. That's why I'm in this movement. So yeah.
I mean, I think if we had to just kind of make a very simplistic meme, the system is sick. The systems that are governing sort of health policy and health logistics are ill.
Right.
And one of the reasons why I wanted to do this podcast with you and why I appreciate the work that you and Karen are doing is I don't think the cure is going to come from within the system.
Mm-hmm.
I think the cure is going to come from the populace, from people demanding with their feet and their wallets a different kind of care and a different kind of experience, and their advocacy, their political advocacy is also incredibly important. But I don't think the system is going to heal itself. So I think people really, really need to be aware of how conflicts of interests are embedded in every level of not only medical practice, but the generation of, medical and scientific knowledge.
Right.
What gets funded, what gets published, continuing medical education for doctors, the ways that medical schools are funded by commercial interests. And then, you bring up also in terms of legislation, I forget the statistics, but I think the pharmaceutical industry might be either first or maybe second in line to the, sort of broadly speaking, the energy industry in terms of the lobbying dollars spent in DC. Enormous lobbying dollars with really endless pockets, endless and very deep pockets.
And that's actually one of our cornerstones at American Health Revolution. We call it our chronic disease marketplace, because that's really what it is. It's a big industry with a lot of profit-driven, policies, right? That reach into our health agencies and our members of Congress. And I agree with you that the cures are going to be coming from the populace. And I think I'm already seeing that happening, right? I mean, you see this big trend, with parents looking for, functional pediatricians, or even leaning more towards more flexible family practice doctors, right? And people are changing the way they do things, and it's nice to see, right? And I know that I've been doing it for about 20 years now. So more and more people are opting for functional medicine and diet and home births. It's just a trend that I'm noticing.
Mm-hmm.
Here's a sign of what we're up against in terms of the ad spending. This is the healthcare industry and pharma digital ad spending. You can see a very, very steady rise. So this is just to let people know this is what we're up against. And this is when I talk about the medical industrial complex, guys,
right.
This is what I'm talking about here. This is, I wish people would take a moment and just try to take this in, breathe in the incredible force behind this complex of companies, agencies. This is scary stuff to me. Okay.
It is. And I really think it takes a lot of effort for each, average citizen to understand this big complex web, right? A lot of people are busy, they're working, they have families, and they just don't really have the time to just sit down and figure things out. It takes a lot of effort and research, to really know what's best for you. But it's necessary at this point. It's necessary because you kind of need to understand for yourself this disease process. That's what I would say.
And I think also, we don't have to just kind of reach to sort of like conspiratorial, there are people wanting to do bad. I mean, profit motives, the way that they align and the confluence of profit motives, like there's nothing wrong with generating profit, right? It's just when our incentives when the profit incentives don't align with individual health incentives that we have a problem. I mean, in some respects, profit drives innovation and new technologies.
Right.
I'm even thinking just one example that's on my mind recently is just the explosion of scientific literature about the role of full spectrum light and near infrared and far infrared light in human health and mitochondrial functioning. And, there's been an explosion of, products on the market to help kind of capitalize on that. Now, we still need, more data in those areas, but, I think that's incredibly exciting. And, there are ways that in that example, profit potentially aligns very directly and fully with individual health outcomes. But there are a lot of ways, in the system as a whole that that is not the case.
Right.
There are many examples of those conflicts. Upton Sinclair, Dr. Fogel, it is difficult to get a man to understand something when his salary depends on him not understanding it. Mm-hmm. And I think we have a lot of that. Somehow people want to trust their doctors. They want to inherently trust the white jacket. People don't trust their financial advisors as much, or their lawyers, or their mechanics, right? But there is this inherent, I want to trust my doctor. They have my health and well-being, my family's health and well-being at heart, right? And I think most doctors, and I think you would agree with this, also have their patients' interests at heart. But like you said, they're stuck in this system. And the only way to change the system is, as we said earlier, through the grassroots effort. We, the people, need to change the demand side of the equation to force them to deliver to us what we require.
Right.
I'd like to turn our attention to the Ford study, if you don't mind. I have a clip I'm going to show in a moment. You were featured in that documentary, which was created by Del Bigtree, and it was a study, a retrospective study of vaccinated versus unvaccinated children. and I'll let you and Karen go into some details on that together. But before I do that, I'd like to show this. It's just a 1-minute clip, and it'll kind of reveal some of the issues that come up with studies and how they're being castigated out of hand. So let's see if we can get this going here. Okay.
Impact of childhood vaccination on short and long-term chronic health outcomes in children, a birth cohort study.
This one is really robust.
Let's say the results.
Yeah, what were the results?
The CDC put out a white paper on how you would look at vaccinated versus unvaccinated, and we followed it to a T.
I agree with you.
No.
You agree with that?
No, yeah,
We 100% did. We looked at this every other way and sideways.
I think this is a devastating commentary on our public health interventions, because if this is true, we are systematically making kids sick, and not just a little bit sick, very sick.
So that gives us an insight into what some of these numbers revealed. And the knee-jerk reaction from the industry seems to be discredit it, find a reason not to follow up with further studies. And that's the part that bothers me. Is it a perfect study? You tell me. It's probably not, but you would know more than me about that. But what seems pretty clear to me is that this should be a 5-alarm fire for the CDC to get to the bottom of why these numbers are looking like this. Tell me.
Yeah, so this was a large retrospective observational study of over 18,000 consecutive live births that occurred within the Henry Ford Health System in Michigan. And that system is like called a captive payer system, where people are both receiving medical care in the system and their insurance is driven through that system, so that even if they receive care outside of the system, the insurance portion of it will track potentially the care that they receive outside of the system. It's similar or has overlap with what we call an HMO. So they looked at about 18,400 consecutive live births, and of those, about 1,900 children were fully unvaccinated during the period of the study. And so they were able to compare those that received one or more vaccines with those that received none. And again, because of the captive payer system, they could be fairly certain that they could track the doses received pretty accurately. And what they found was that the vaccinated children were about 2.5 times more likely to have a chronic health condition. They were 4.5 times more likely to have an asthma diagnosis. They were 3 times more likely to have an atopic disease, which is a subset of allergic diseases. They were 6 times more likely to have an autoimmune disorder, and they were 5.5 times more likely to have a neurodevelopmental disorder. So the health outcomes really showed a staggering difference. Now, the study received criticism, and in some ways, I think valid criticism, because whenever you're doing a retrospective observational study, there are issues. In particular, you can't always control for inherent differences between the groups that you're studying. In this case, some notable differences were that the vaccinated children tended to have higher rates of low birth weight. They were more likely to have been born premature, which potentially would be, a risk factor for all of these conditions. Those who were unvaccinated had less contact with the medical system. So maybe there was something called ascertainment bias, where they simply weren't getting these diagnoses because they weren't being seen often enough in the medical system. And the children who were unvaccinated were followed within the system for shorter lengths of time. So there are reasons to, be cautious about the data. But to me, the answer is not this is invalid. To me, this is a call for we need to replicate this, and not just once, like 2 or 3 times in different areas of the country, in different medical systems, trying to more fully control potentially for differences between the groups whenever possible. So that said, I think the magnitude of the differences in risk ratios between what we call hazard ratios between the two groups are really significant.
Right.
And it would be difficult to imagine that all the findings can be explained by these underlying differences in the groups. Again, this is a hypothesis. It's a hypothesis that deserves to be tested and deserves to be replicated, in particular because we have science that relates to these findings that potentially suggests that these findings could be accurate. So one area of scientific investigation, which has been largely headed by someone named Christine Stabell-Ben and Peter Abbey in Europe and Scandinavia, has investigated what they have termed the non-specific effects, and some people call them the off-target effects of vaccines or any health product, really, right? For example, I'll give you a non-vaccine example. Statins, which are widely used to control blood lipids and cholesterol, can have negative impacts on mitochondrial functioning. They make mitochondrial functioning more sluggish, which can have a lot of health effects down the road that you wouldn't see initially. So in the data that Dr. Ben and Dr. Abbey have been replicated across different research groups, but without spending too much time on this, what they were able to show is that vaccination seems to have long-term effect on the way that the immune system functions. And what they noticed, which is really interesting, is that their data suggests that live virus vaccines, so things like the measles vaccine or the chickenpox vaccine, seem to produce beneficial effects on the immune system, and that they decrease in their studies overall mortality, irrespective of the illness that they were targeting. But conversely, non-live virus vaccines, things like hepatitis B, DTaP, other vaccines, non-live virus vaccines seem to have negative non-specific effects, and in their data sets, increased overall mortality, even though they were protecting against the disease that they were designed for. And this really suggests that I think, Dr. Stabell-Ben did a really wonderful TED Talk a number of years ago where she hypothesized that perhaps the technology underlying our non-live virus vaccines tends to make the immune system less flexible. It makes it really strong in this one direction for the illness that it's targeting, but maybe it makes the immune system sort of less flexible in other areas. That was her hypothesis. And she likened it to, a live virus vaccine is someone training with a tennis coach, and they're learning all different kinds of ways to hit the tennis ball versus someone who's having a ball machine hit the ball in one particular direction over and over again. They get really good at hitting the ball in that particular spot, but maybe they lose the agility, in other areas. I think that's a nice metaphor. So that, and I also think that the data, there's a body of scientific literature around aluminum adjuvant is interesting here. Aluminum adjuvant is used in primarily in non-live virus vaccines, so it's not in the measles vaccine or the chickenpox vaccine. But what a number of different groups have been able to show in animal data is that we used to think that the aluminum just got excreted out of the body, the aluminum in vaccines, but there's been really compelling data that shows that nanoparticle aluminum, the kind of aluminum in aluminum adjuvants in vaccines, can be taken up by immune cells, macrophages, and distributed throughout the body to distant tissues. So from the muscle to distant tissues like the liver and the brain. And there is also data, again, from a number of different research groups, that once the aluminum is in the target tissue, in the end tissue, so the brain, let's say, it can cause local inflammation and even turns on genes to trigger apoptosis, to trigger cell death. And I think this is data that has been largely ignored. For example, when vaccinologists or even the media try to reassure people about aluminum adjuvant, we are ignoring this body of research, which I think one could hypothesize, in my model that I talked about before, primers, triggers, and amplifiers, could act potentially at all three of those, could be a primer. Creating sort of local inflammation that then propagates throughout the system. For some people, it could be an acute trigger, right? Sort of something that tips them over the edge. So, I think because of those two areas of research, I think it makes sense to replicate the Henry Ford study because we could have a hypothesis that we might be creating negative, nonspecific, and off-target effects that are increasing the risk of chronic illness. And that risk will express itself then in terms of the person's genetics, right? Some person and other environmental exposures. So one person gets asthma, one person gets an autoimmune disorder, it will express itself differently depending on the other genetics and other vulnerabilities.
It's very interesting what you mentioned about the aluminum and the nano aluminum that can travel into these macrophages throughout the body. I believe there was a small study done by a researcher in the UK, Chris Oxley, that found very high levels of aluminum in the brains of deceased individuals with autism. Is that correct?
Yes. Mm-hmm. And that is a finding that has also been replicated in Parkinson's. Parkinson's or Alzheimer's or both. I think both. I'd have to double check that. But in a sort of a neurodegenerative disorder that we tend to associate with old age,
right.
There have also been findings of increased brain aluminum. Yeah.
A couple of comments. You mentioned that the Henry Ford study was used with data from a captured payer system. It's a large HMO, basically, right?
Mm-hmm. Yeah.
I believe that that is what constituted the vaccine safety database that was managed by the CDC or HHS. It was the same type of database. Is that correct?
That's my understanding, that the CDC for many years was managing something called the VSD, the Vaccine Safety Data Link, which was data that was provided from a number of different HMOs for the purpose of investigating vaccine side effects or vaccine adverse effects. Yes.
Yeah, and it seems like that was never really done, the same type of study comparing the health outcomes using that type of data. But there have been smaller studies, correct? There have been smaller studies done independently of the health, comparing the health outcomes of vaccinated versus unvaccinated. Is that right?
There are a handful of smaller studies that do have, I think, significant methodological limitations, but they all suggest kind of trend in the same direction, which is an increased risk of chronic illnesses. In some cases, the more vaccines a child has received. And again, I'm just going to, take a moment here. Our public health authorities are very interested and concerned with protecting against infectious illness.
Right.
And, every vaccine has its own efficacy data, but, they do protect against infectious illness. I think the practice of, neonatal medicine, so very early pediatrics, has been transformed by things like the Hib vaccine, where babies just don't get meningitis from Hib anymore, and it's transformed practice. We don't contend with infections in childhood like measles or chickenpox. So I think that I just want to emphasize that that is the case, right? We are protecting against infectious illness, and we've derived benefit from that as a society. But I also think that there are people who want to ask the question of whether, alongside that good, we have had negative off-target effects that are potentially impacting things like long-term immune functioning, mitochondrial functioning, oxidative stress, that are impacting the underlying systems biology factors that may be creating an increased risk of chronic illness. I think this is not an unreasonable question to ask, but I think, to Paul's point before, the people who want to ask it have been absolutely vilified and portrayed as sort of cranks and scientifically illiterate. And I think even within, one of the problems with systems, one of the illnesses of our medico-industrial complex system is that there's no way to even ask these questions. There's no one to fund these kinds of studies, unless, I think, it comes from the federal government, which it hasn't until now. But even asking the question can ruin your career.
Right.
Wow.
And
yet
of the things
the
that was in the documentary,
the precautionary principle demands that we ask those questions, does it not?
I think so, and I know that you think so. But I do have empathy, for my colleagues who haven't been trained in a systems biology model, who don't know the data about nonspecific or off-target effects, potentially negative nonspecific or negative off-target effects, who deal with the repercussions of infectious illness. I have a good friend of mine who's a pediatric ICU doctor who had several patients have acute encephalopathy from the influenza this year and died. So I think our colleagues are, everyone's afraid, right, of something. And I think my colleagues in the medical profession are really, really afraid of a resurgence of infectious illness. And I think there's reason to validate that. I think for parents that I've worked with who have autism with severe chronic co-occurring medical conditions, for example, or other, chronic health conditions, they're afraid of making that worse, or they're afraid that potentially, the adverse events that they, some of them witnessed around in connection with vaccination played a role in what their child is suffering from right now. And we don't have the data to dispel that. Despite what our media keeps telling us, we don't have the data to say that isn't true.
And I think it would be great if there was a simplified way to do an individual risk-benefit analysis based on family history, maybe even based on certain genetic variants, or even give this childhood schedule in a safer way.
So I think what that would require, and I think some of my colleagues in the Autism Innovation Coalition and I, talk about like really, if you were going to design a study for any medical intervention now, you would include biomarkers and proteomics and immune functioning markers. Like, let's see what the status of the immune system is in terms of cytokines or inflammatory markers at baseline. Let's see redox status. Let's look at markers of mitochondrial functioning before,
right,
and then after, because that's really going to give you like granular level, like what's really happening inside the body from whatever this medical intervention is that we're doing. And are there individuals, are there subjects who have outsized reactions that maybe shouldn't take that product anymore, or for whom in the case of vaccination you might design a slower schedule, a gentler schedule. You might give interventions to promote resilience, so things that would promote mitochondrial functioning. There's really ways we could do this without having to say, okay, we're going to abandon,
right,
vaccines.
It doesn't have to be all or nothing.
We could do personalized medicine, and we could include resilience interventions, N-acetylcysteine, glutathione, other mitochondrial supports in vulnerable children. But we don't know who's vulnerable.
Right.
So,
but it's interesting how we're finding out, many of us are finding out we were vulnerable. I was a vulnerable pregnant mother with preeclampsia, right? And RhoGAM shots that were very high in thimerosal.
Yeah.
Dr. Fogel, you would like to see, I'm sure, some studies on neurodevelopmental regression. You would like to see a systems biology approach. You probably touched on some of that already, but would you care to elaborate on those a little more?
Yeah. I think the parents and children who've experienced neurodevelopmental regression have been utterly and completely failed by our medical system. At first, parents were told actually it wasn't true. They didn't even have neurodevelopmental regression. There was a whole
gaslighting.
It was sort of like the refrigerator mother hypothesis of autism, which was sort of many years ago. Then, we had a period where neurodevelopmental regression, was denied. And parents were gaslit about what they had seen with their own eyes and ears. We now know the data suggests probably roughly 40% of those with autism have a neurodevelopmental regression. There's some variability in that number, but I think 30 to 40%. But neurodevelopmental regression should be a medical emergency.
Yes.
Akin to someone having a stroke or acute encephalopathy, which is, I think, what is often part of the picture. And what I would like to see from our federal agencies, what I would like to see is a large-scale registry for neurodevelopmental regression, where that would include individual biomic data around neurodevelopmental regression. So what that would look like in practice, you would have a series of emergency rooms and doctors' offices participating. Anyone who presented with neurodevelopmental regression would get a specified kind of workup, including with potentially research markers. So proteomics, different protein compounds, immunological markers, cytokines, mitochondrial functioning, like a real workup to see, sort of what happened. And I also think that we need to start offering interventions and treatments that may not be fully researched and vetted, in part because if you can reverse neurodevelopmental regression early, you can save not only a child's life, but their siblings and their parents' lives also.
Right.
And so what that would look like potentially would be things like giving a steroid burst, maybe intense investigation of nutrient levels, anti-inflammatories. I think what we see, there's a lot of overlap between the symptoms of neurodevelopmental regression and what we see in PANS, PANDAS, which are neuroimmune disorders where people lose acute functioning and develop very acute neuropsychiatric symptoms. So I appreciate that, many of my medical colleagues will kind of be like aghast at the idea that we would be offering treatments that haven't been fully evaluated in terms of like evidence-based medicine and robust clinical trials. But given the seriousness of neurodevelopmental regression and that we have anecdotal clinical data and some data from PANS, PANDAS that things like looking for an underlying infection and treating it, using steroids acutely, targeted, other metabolic interventions can be helpful for some individuals. And I think we have to be trying things for these kids because we can't just say, well, there's no data, so we can't offer you anything. And I think that's what I love about sort of the functional medicine and integrative communities is that, my colleagues in those communities are trying to take preclinical data, animal data that makes sense for potentially trying to intervene and at least trying it in people.
At least trying.
Low risk interventions, right? Like these are low risk interventions. They make sense from a chemistry standpoint, a metabolic standpoint. We may have some animal data. Like let's at least for neurodevelopmental regression, we could even put together a couple of different protocols that could be trialed to see if we could help kids. But we really, really need that. There's a lot more neurodevelopmental regression happening than even, people can't even access providers who have a functional medicine or integrative medicine background. And so I really would like to see a national registry for neurodevelopmental regression.
That would be wonderful.
And we're not going to get into this today. It would be a whole separate podcast, I think, because a lot of what we're talking about, I think, applies to the way things have gone with cancer in this country and globally, and how, similar. I remember when Nicole Shanahan talked about being approached by private equity about how to treat autism, like at treating it as a $1 trillion business opportunity, Dr. Fogel, and dealing with it from that perspective, as opposed to looking at it from, the functional medicine point of view, and looking at it from wellness. And this is a chart of functional medicine, looking at root cause, and this is courtesy of, is it the Living Proof Institute? And I thought this really depicts a lot of the issues that we're faced with. You're looking to address this here at the bottom. Many of the resources are being devoted to addressing it at the top, where, if we can get to the underlying causes of things, we can certainly help create a healthier environment. So I just wanted to show that, and I know that I'm seeing cancer on the increase. I'm hearing about it every day. Right. People we know, and it's something that, like you were saying with these studies, let's go back and do the studies. Correlation is not causation, but that phrase is not an excuse for not doing further studies, right? And that's the whole point, is let's get to the bottom of this so we can create healthier communities.
Yeah, I'd like to get back to the example of cancer, because I think that's an interesting one. I think in terms of prevention, we're doing a kind of an abysmal job in terms of cancer, because as you point out, cancer rates are going up. However, in terms of cancer treatment and utilizing precision medicine, really trying to break up, like even breast cancer, right? You don't, like if someone gets diagnosed with breast cancer now, it's not just one thing, right? We're subtyping down to the level of genetics and receptor types of what that cancer is, and then being able to intervene at this very personalized, individualized level of the cancer.
Very precise.
Now, we're not doing it as well with the individual levels of the person in their body, but at least with respect to cancer, the outcomes for those who do get cancer are much, much better than they used to be. And I feel like we need to bring some of the same precision to autism. In terms of understanding, mitochondrial functioning, oxidative stress, immune functioning, really understanding like which of those systems is primarily responsible for tipping someone over the edge into regression or into a symptom flare, for example. And so I think on the one hand, we can be a little bit depressed by the cancer situation in terms of prevention. But I think on the other hand, the progress in terms of treatment, I think is something that we potentially could bring into autism.
And there's probably a lot of overlap too, I've been following Dr. Thomas Seyfried with the metabolic underlying drivers of cancer, and that's sort of more broad, right? And you can kind of bring in that functional component, combine it with this more targeted, advanced, treatments that are being developed that are increasing survival, in patients, in cancer patients.
Yeah, so, just for your audience, so like he's someone who advocates for sort of metabolic therapies and has talked a lot about the ketogenic diet as a one of the pillars of a treatment for cancer, for certain types of cancer. And I think that's a really interesting avenue. And I think likewise for psychiatric disorders, neuropsychiatric disorders, and potentially autism also, I see a lot of hope in terms of metabolic therapies like the ketogenic metabolic therapies. Yeah.
Excellent. Right. And I love how you drew that distinction between, the prevention and the treatment. Two very different things.
I mean, I think one thing, as an autism parent myself, and, being a part of the autism community and having treated parents, we want better science and we want better treatments. I mean, we need to really think a lot about prevention, but there are millions of children and young adults now that have autism. And again, I'm talking about the more severe end of the spectrum with co-occurring medical conditions. There is, some on the autism spectrum on the milder side who feel that this is their identity, that there doesn't need to be treatment. And I fully support those people. But those people are very, very different from, like my son and many of the patients that I work with and treat, whose symptoms are devastating and prevent them from participating in our community, participating in families, from enjoying life, from ever having the joy of being an independent adult who can just walk to the refrigerator and grab something that they might want to eat and make it, for example. Like the smallest things that we take for granted, individuals like my son cannot do. So I think for those people, we need treatments. We need metabolic therapies, dietary interventions, mitochondrial supports. We need repurposed drugs. Like we need whatever it takes. We need to figure out treatments that address the underlying systems biology to improve symptoms. And right now, I would say the majority of autism treatment is symptomatic treatment using psychopharmacologic interventions, primarily antipsychotics and SSRIs, and they don't work that well.
Right.
And they have a lot of side effects. If they worked really great, we wouldn't be here, So,
right.
So anyway, we want treatment. And so, I think in terms of health advocacy, we think a lot about, prevention, but for autism in particular, for chronic illnesses, we need treatments too.
Nobody knows better than you, Dr. Fogel. And I am awestruck by your passion, by your brilliance, by the way you lead with your heart. It's so obvious. And I'm hoping that your voice resonates at the very highest levels of the medical community. I really do. Do you have any concluding thoughts, Karen?
I'm just very grateful for the work you're doing, Dr. Fogel. I have an affected son, and all of this, is kind of the world I've been in for the past 20 years after realizing he was medically sick. And it is challenging as a parent. I do have a lot of, the chronic illnesses as well. And so it is challenging. And so I am truly grateful for the work you're doing with your team.
Thank you, Karen, and likewise to you as well as an autism parent. Many of us as parents, one parent, if it's a two couple, if it's a couple, one of the parents can't work.
Mm-hmm.
I know myself for many years I had to pull back from practice and was only really minimally working because I couldn't do it. I couldn't do it in terms of the logistical demands of caring for my son, but I also couldn't do it from my own energy level and mental health level and just being depleted and hopeless and struggling and watching his, suffering day to day was really hard for me. And there were periods where I couldn't work, and I luckily, unlike many families, had that luxury.
Mm-hmm.
But many of the parents that I work with, their careers have been, if not destroyed, radically altered because of the needs of caring for their children. And which is not, in typically families with typically developing children, there's an intensity to the early years that dissipates over time.
Right.
But for families like yours, Karen, and mine, those needs won't appreciably dissipate.
Right.
And it's lifelong. And then, of course, the issue that many, many autism parents talk about with, I think, great worry and sadness is, who's going to care for their children after they pass.
It is.
And that's a huge issue that we need to contend with as a society as well.
Very, very difficult to even go there, right?
Yeah.
Even think about it. Yeah.
God bless both of you. Thank you for taking the time today. This is a very, very meaningful dialogue, and I hope, just for the sake of everyone's well-being, that we get this message out to everyone. Thank you.
Thank you so much.
Thank you.
And we'll leave it there.
Thanks for having me.